Hello, I'm Beth Wagner, physical therapist. In this video, I'm going to show you the suprascapular nerve glide. This is an excellent exercise to glide or floss the suprascapular nerve. First, I'll mention briefly a bit about the anatomy of the suprascapular nerve, and then we'll jump right into the gliding exercise. The suprascapular nerve originates in the cervical spine. Specifically, it comes off of the C5 and C6 nerve roots. It travels down the neck to the top of the shoulder blade and through a gap covered by a ligament called the suprascapular notch, and then through another ligament-covered gap at the back of the shoulder blade called the spinoglenoid notch. Injury to the nerve can cause shoulder pain and weakness of the rotator cuff, specifically the infraspinatus and supraspinatus muscles, which are responsible for lifting the arm and moving it out to the side. The nerve can be injured through compression or traction due to repetitive overuse in athletes or occupations such as painters. The nerve can also be compressed due to excessive fluid or tissue buildup in the area, such as a ganglion cyst. And finally, it can be injured following trauma due to a direct hit to the area. The first step is to stop the activity if overuse is the cause of the entrapment. Allowing time for inflammation to resolve and for tissues to heal is an integral part of recovery. The next step is to free up the nerve where it is pinched. Now, nerves do not like to be stretched. Instead, they respond well to gliding or flossing, which is to move one end at a time through the area where it is pinched. The movements are performed gently in slow and smooth repetitions. There is no hold involved. Mild discomfort is common during this floss or gliding exercise, but pain, numbness, or tingling are signs that the nerve is being compressed or overstretched, which is not our goal here. If you experience pain, numbness, or tingling, or if your baseline symptoms worsen as you're performing this exercise, stop the movement, shake it out, and rest. After the pain, numbness, or tingling stop or return to their baseline intensity level, then go ahead and continue. Okay, let's move on to the nerve glide. First, let's do a quick posture adjustment in sitting. Make sure that you're sitting on a supportive surface with your feet flat on the ground. Starting at your base, be sure that your pelvis is in a neutral position, so you're not slouched back and you're not overly arched. Now moving up the spine, lift your chest and relax your shoulder blades. Do a few shoulder rolls, bringing your shoulders up, back, and then down. And finally finish with a small cervical retraction, tucking your chin in, just enough to align your head over your neck and shoulders. I'll demonstrate this first for a left suprascapular nerve involvement. The first step is to tip your head away from the side involved, which tensions the top of the nerve. So I'll tip my head to the right. Just moving as far as is comfortable. Don't press too far into this head tilt. Now we'll floss the lower part of the nerve, where it is compressed through the notches, by moving the scapula, or the shoulder blade. Lift the left arm overhead, bringing it as close to your head as possible. Pause, and then slowly lower your arm. Again, lift your arm up and over, pause at the top, and then, with controlled movement, lower your arm. And again, continue lifting your arm up, bringing it as close to your head as you can, pausing, and then lowering your arm. Lift, pause, and lower. Lift, pause, and lower. It can also be very helpful to pattern your breathing with the nerve glide to help calm and relax your nervous system. You can try exhaling as you initiate the movement, lifting your arm overhead. See what pattern feels best for you. The most important part is to be sure you're not holding your breath as you do the nerve glide. If you have any weakness or inability to lift your arm overhead, you can use your other arm to help. So if I use my right arm to help, I would tip my head to the right and then lift my left arm using my right arm to assist overhead, and then lowering it back to the side. Again, lift the left arm overhead, bringing it as close to your head as possible. Pause, and then lower. Again, lift the left arm up, pause, and lower. Lift up, pause, and lower. Shoot for 10 repetitions, or as many as you can do to start with. Gradually build up session by session until you can complete 10 repetitions. Now I'll demonstrate the suprascapular nerve glide on the right side. I'll tip my head to the left and lift my right arm overhead. Pause, and then return. I'll lift my right arm overhead, pause, and then return to the starting position. Lift and lower. Continue lifting the arm, bringing it as close to your head as possible, and lowering. Lift and lower. If I match my breathing with this, I can try exhaling as I lift, inhale, lower, exhale, lift. Inhale, lower. Exhale. Inhale. Exhale. Inhale. After 10 repetitions, or as many as you can do to start, rest and shake it out. If only one shoulder is affected, you can start the nerve glide just on the side that's involved. Ultimately, for the best balance and flexibility between muscles, tendons, ligaments, and fascia, I recommend doing the nerve glide on both sides. This is also a great way to compare your normal, which is what it feels like on the side that's not involved, and what the nerve glide feels like for the side that is entrapped. Oftentimes, even after pain, numbness, and tingling dissipate, you might still feel a lingering sense of tightness or discomfort or restriction on the side that's been affected. And you might notice that more if you are performing this on both sides. I recommend performing the glide exercise several times a day and shoot for doing this daily, but 5 to 6 days a week is great. In addition to this nerve glide exercise, you might also benefit from strengthening of the rotator cuff muscles and scapula. Watch my rotator cuff strengthening and other shoulder rehabilitation videos for examples of other exercises and information that might be helpful for you. I hope you find this nerve glide exercise helpful to reduce pain, numbness, and tingling in your shoulder. If you like this video, please give it a thumbs up and subscribe to my channel. Leave any questions or comments below and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a fantastic day.